She is a staff She's a staff physician at the Student Vaden Health Center and clinical assistant professor in the Stanford Department of Medicine. Dr. Farid's debut picture book, When You Breathe, was released in the fall of 2020 and won a 2021 Notable Poetry Book Award by the National Council of Teachers of English. She has been a valued member of the Diversity and Inclusion Council, including the subcommittee for this inclusion rounds. And she was instrumental in getting our invitation out to Dr. Campo. I will turn it over to her for introductions. Thank you.
Thank you so much, Dr. Dunn. It's absolutely a joy to be able to be with you all today. Dr. Rafael Campo is a trailblazer. I don't think there's any other better word to describe him. He's a poet and a physician who is lauded for his humanism in patient care while serving at the forefront of medical humanities. Dr. Campo teaches and practices internal medicine at Beth Israel Deaconess Medical Center and Harvard Medical School, where he directs the Art and Humanities Initiative's literature and writing program. He's also the poetry section editor for the journal JAMA. He's the author of 9 highly acclaimed books. His third collection of poetry, titled Diva, was a finalist for the National Book Critics Circle Award. His honors and awards include a Guggenheim Fellowship and a Lambda Literary Award for his poetry. His poetry and essays have appeared in numerous periodicals, including The Nation, The New Republic, The New York Times, Poetry, Scientific American, The Washington Post, and elsewhere. His new volume of poems, Comfort Measures Only, is now available. Dr. Campo's poetry gives voice to our often voiceless patients and to the physicians bound by a clock to cure, while reaching to hold on to the art of medicine. His poetry shines a light on what it means to empathize, connect, and heal. In his 4th collection of poems, Landscape with Human Figure, there's a striking poem titled What I Would Give. The poem begins with a doctor wanting to give more to his patients, more than what the poem calls the usual prescription, fear transfigured by some doctorly advice. He goes on, I'd like to give them my astonishment at sudden rainfall, like the whole world weeping, and how ridiculously gently it slicked down my hair. Reading Dr. Campo's poetry is to experience the astonishment of doctoring, the astonishment of illness, and the astonishment of our own humanity. We are deeply honored to have him with us today. On behalf of the Department of Medicine's Diversity and Inclusion Committee, welcome, Dr. Rafael Campo.
Thank you so much for that incredibly generous introduction. And thank you all for joining us this afternoon, I guess I can say, now on this occasion to help celebrate Latinx Heritage Month. And again, I'm just really, really honored and thrilled to be here. As you heard, I am a doctor and a poet. And when I first contemplated a career in medicine, I supposed I wasn't really very likely to succeed. And I think that was really because of who I am. I remember thinking first about my faith and not seeing much of a spiritual life among physicians. I thought that might create a kind of challenge for me. And then I considered my ethnicity and not having many Latino role models to inspire me to have a career in medicine. I suppose that might be another kind of barrier for me. And then I, of course, am gay, and the homophobia I'd experienced at a pretty young age in doctors' offices made me believe that perhaps that was the greatest obstacle to this dream I had of studying medicine. And as it turned out, when I finally arrived at Harvard Medical School, it was my identity as a poet that really alarmed my new peers and colleagues and faculty and attendings. All these other aspects of who I am certainly were challenging and posed some difficulties, but being a poet really freaked people out. And and I always like to tell that story now with a sense of the irony in it, because I really cannot imagine the work of healing today without the presence of poetry in my life. And so I thought I would start with a poem that I hope shows how in some ways poetry and healing are really inextricably interrelated, and really try to illustrate that profound connection in how poetry, I think, can really in some ways locate us physically in relation to these diverse and sometimes fragmented identities we harbor, and at the same time call us together into community. And so this is a first poem I'd like to share, which is called Latinos. Latinos. Another avocado and I'm done. The guacamole I prepare is for the Super Bowl, a party for a game we watch because Americans love football. And after all, we want to be like them. A couple drops of hot sauce and I'm done. I spoon the guacamole into bowls. You say you love to watch football games. I say you're Puerto Rican and we're gay, so really must we host this stupid party? A sprig of fresh cilantro and it's done. You taste the guacamole, then you smile, reminding me of why I married you. It's just a game, I think. Mi maricon, you say, and pat me gently on the butt. The guacamole finally is done. You sure you aren't a little Mexican? This guacamole is delicioso. I tackle you onto the couch. We kiss a while, watch J-Lo in a Pepsi ad. I feed you chips with guacamole. Done with games, I ask you seriously, not in Spanish, but almost as grave. Is it too late to reconsider? Suddenly, you look delicious, like Lorca, surreal. I taste the guacamole on your tongue. The Super Bowl is just a game, you say. Miami versus San Francisco, sea to shining sea. We sing beneath the strobes and stars, beside Americans like us. Now I'm on the faculty at Harvard Medical School, and much of what I teach has to do with how poetry and literature and the arts and humanities more broadly, I think can help us medical students and physicians become better healers. And it's really kind of a departure from my own medical training, where I remember always being scolded by my attendings to focus on the facts and the data and not pay so much attention to the social history. I remember my attendings in particular, saying all the time, just the facts, Campo. What's the potassium? How many lymph nodes are positive on the CT scan, and not caring so much about whether the patient spoke English or who her supports might be at home or what kind of neighborhood she lived in. And so I think that poetry really does have an important way of helping us perhaps refocus in some of these ways and think more about that broader social context. And so I want to read next a poem that perhaps enacts another reason I think poetry is so useful to us in medicine, in that it helps us, I think, be more empathetic. It helps us understand perhaps what empathy is, and perhaps how empathy can really be useful in the clinical setting, and in some ways kind of counter some of that sort of strict biomedical focus. So this is a poem called The Chart, And again, to my mind, it's a kind of an enactment of empathy. And I still have colleagues to this day who say things to me like, well, you can't really teach empathy. You know, empathy is, you know, this innate capacity we have. And you know, if you didn't learn it from your parents, you're not going to learn it in medical school. But I really do think that, you know, we can certainly model empathy perhaps more effectively than we do, more meaningfully and more consciously than we do. And I think poetry is one way to do that. So this is a poem called The Chart. Says 54-year-old obese Hispanic female. I wonder if they mean the one with long black braids, Peruvian, who sells tamales at the farmer's market, tells me I'm too thin, I better eat. Or is she the Dominican with too much rouge and almond eyes at the dry cleaners, who must have been so beautiful in her youth? Or maybe she's the Cuban lady drunk on grief, who I've seen half asleep, alone as if that bench were only hers, their park her home at last. Or else the Mexican who hoards the litter papers she collects and says they are her documents. If not, it could be the Colombian drug addict whose Spanish, even when she's high, is perfect. Or maybe it's the one who never says exactly where she's from, but who reminds me of my grandmother, poor but refined, lace handkerchief balled up in her plump hand, who died too young from a condition that some doctor, knows in her chart, overlooked. So poetry, I think, can teach us an appreciation of things like metaphor, imaginative, sort of out of the box ways of thinking about the world in which we live in, like irony, for example, as well. And so I wanted to read next a poem that perhaps demonstrates this a little more concretely. Not long ago, I was invited to read at a school of public health here in Boston, and the faculty and students were debating the prevention paradox. And I probably don't have to explain much about the prevention paradox to a medical audience like you, but they were really at odds about whether, you know, targeting at-risk groups with disease prevention strategies was in fact in some ways more stigmatizing and damaging to those patients, especially if patients in the larger society, in the general population, would ultimately end up benefiting more just because of sheer numbers, even though less of them were or might be affected by whatever disease we were targeting. And so I thought, you know, this was you know, of course, an extremely thorny kind of problem or question or series of questions. And I thought, you know, perhaps sharing a poem that might repersonalize or rehumanize some of the kinds of abstract ideas they were discussing what might be useful, might be another sort of way into thinking about some of these kinds of issues. So I'll read next this poem called Unexceptional, which again perhaps helps us to think about some of these kinds of more abstract concepts in more humane or human ways. So this is a poem called Unexceptional. Except we were in love, or so it seemed. The refugees kept streaming past. The cops kept shooting up the neighborhood. Except it seemed that we were happy, pulled the shades and set aside our textbooks, brushed our teeth. The honor killings went unpunished while we aged together, holding hands as we succumbed to sleep. It seemed that life was good, except Black mothers kept on dying young. We said our vows in church, and afterwards it seemed that queers were harmless, even mattered. The loved ones in our photographs gazed back at us, or at each other, or beyond. Except the virus struck, the pipeline burst, the hurricane made landfall, killing thousands. We splurged on business class as if the wine at 30,000 feet could taste more sweet, except that they worked hard, but since their son OD'd, it seemed that it was pointless now. The oligarchs kept stealing from the state. The politicians blamed the poor, except the lamplight glowed and music streamed as if the internet was limitless and magical, as if we knew that anything for which we searched was certain to be found. We watched a baseball game on television, just like anybody else. It seemed like we were normal when the garden needed watering, while elsewhere, in the desert, someone was interrogated, beaten, kidnapped, raped. Except it didn't happen here, but there. Except it happened not to us, but them. Except the sunset from our porch refused again to be the last. So damn beautiful. So perhaps another limitation of a too strict or too narrow biomedical view of disease, of illness, is that we tend to miss things, miss sort of the bigger picture. And I think this next poem, which I want to read, always reminds me of how poetry, by kind of getting us to look up from our endless checklists and our sort of unending hospital corridors, that perhaps we might do things a little bit differently, or might think about what we're doing in a different kind of way. And this patient who you'll meet in this is an example of how I think, or of perhaps why that's so important. I met him when I was on my pediatrics rotation during my third year of medical school, and I was on call that night with my team and paged in the middle of the night to put an IV into him. And so I sleepily, trudged to the supply closet and gathered all the stuff I needed, and headed over to his room and set everything up on the bedside, and began to try to put this IV in. And he was wearing dinosaur pajamas and was half asleep, and so I just kind of brusquely started doing what I had to do, and I tried once and missed the first time, tried again, sweat starting to sort of pour down my forehead, and still not getting the IV. His nurse is at the door, sort of glaring at me and saying, this competent medical student, you're torturing this poor kid. Can't you just, do your job? And finally he looks up at me with these huge eyes and says, doctor, don't worry, you're doing a really good job. And I just remember that so vividly. And again, I was so focused on, this sort of task, this procedure, this sort of, means to a medical end, that I completely lost sight of this human being I was taking care of, and that he was capable of taking care of me in that really, really painful moment for him. And so again, this poem is a way to perhaps remember that, and help us, help all of us, hopefully to think a little bit more broadly about what we're doing every day in the hospital and in our clinics. So this is a poem called Age 5, Born with AIDS, for my patient. In Jaime's picture of the world, a heart as big as South America shines out, the center of the only ocean. 3 stick figures, one is labeled me, are drawn beside the world as if such suffering could make us more objective. Jaime's bald and has no mouth. His parents aren't like him. They're all red lips and crazy yellow hair and grins. There is no title for his work of art, except the names we give ourselves. So I've talked a bit about metaphor and how it might be useful to us in medicine to understand things like metaphor, storytelling, narrative more broadly. But I wanted to read a little, or a couple of paragraphs actually from the introductory essay to my newest collection of poems, which I hope maybe fleshes that out a little bit more. Many of you probably know the esteemed literary critic Susan Sontag, whose seminal essays, Illness as Metaphor and AIDS and Its Metaphors, critiques, I think rightly, some of the more kind of pernicious, superstitious thinking about illness that can actually really harm people living with illness. But at the same time, I've often been a bit troubled that she doesn't perhaps give enough space or enough oxygen to the idea that more positive metaphoric constructions might actually be beneficial in coping with illness and helping us to understand the experience of illness. So this is a few paragraphs from an essay called Illness as Muse that, again, I think, or I hope, articulates this a little more clearly. So this is from Illness as Muse. I find myself in my clinic again, the exam room speaking aloud in all of its blatant metaphors, the huge clock above where my patients sit, implacably measuring lifetimes, the space itself narrow and compressed as a sonnet. And I'm immediately back to thinking about writing. Soon enough, my patients start to arrive, and the way they want me to understand what they are feeling only immerses me more deeply in language's compelling alchemy. The pain is like a cold, bitter wind blowing through my womb, murmurs a young, infertile woman from Guatemala with what I have diagnosed much less eloquently as chronic pelvic pain. Please, doctor, can you heal me? I regard her from across the desk and feel grateful for the computer terminal more immediately in front of me, which allows me to type a little medical jargon into my note before having to actually speak to her. We have had this conversation before, which I realize is another way of saying we are together part of a narrative, a story in which irony matters, in which understanding metaphor, might her pain be a wordless expression of her deep sadness at her inability to have a child, or perhaps the consequence of some trauma on her journey north she has not disclosed, seems to have irrefutable value. Now I am thinking again about writing, but not a prescription for the pain medications she always refuses. Instead, I am thinking about writing a poem. I'm thinking about the metal speculum clattering in the sink while she sobbed softly after I performed her last pap smear, as if it were trying to reiterate something about coldness and bitterness, or what we hear and can't hear, or pain and objection. Perhaps something about this young woman reminds me of my Cuban grandmother, herself an incurable and incurably hopeful immigrant, which only amplifies my narrative impulse. After all, it was my grandmother who first inspired in me a love of stories. Her words were all she could give me of our homeland, Cuba, that exotic and forbidden place, her own unspeakably painful void. My grandmother was afflicted with what seemed an unfair burden of illnesses. Her treatments for her ailments seemed just as varied as the ailments themselves, from the pills she dutifully swallowed each morning, some prescribed to her by doctors, some dispensed out of her friends' personal hoards, to the prayers she recited before her own tiny shrine to the Virgin Mary, from the magical, strange-smelling potaje she brewed with roots and herbs that can't be found in American supermarkets, to the sheer will to endure that seemed manifest in her meticulously kept apartment and her constant humming to herself of old Cuban songs. Some of her illnesses were familiar ones, like diabetes and rheumatoid arthritis. Others were conditions that seemed utterly untranslatable from Spanish to English, like the terrible patatú some kind of debilitating nervous attack, or the more insidious but equally awful retortero, which could afflict her for weeks or even months. Through her experiences, I saw firsthand how indistinct could be the boundary between the tersely biomedical and the wildly superstitious. She took gold for her painful joints that the rheumatologist prescribed, the same doctor who ridiculed her use of traditional Cuban remedies. As an impressionable child, I marveled at the idea of this precious metal somehow gilding my grandmother from within, protecting her joints from damage by the power of our pure wonder at it. Decades later, when she finally died of kidney failure induced by the toxicity of what proved to be a worthless treatment for her, I learned the meaning of irony for the first time. If her rheumatologist in his starched white coat could have been so wrong about one form of treatment, maybe he was just as mistaken about the mystical powers of what was prescribed by the curanderas, whom he regarded as ignorant or even savages. So whenever I read these next poems, someone almost always comes up out of the audience afterwards and remarks, "Oh, those poems you read towards the end really reminded me of that television show, and it used to be ER, and more recently it's been House or Grey's Anatomy." And then the next comment is, or question is, do you watch Grey's Anatomy? At which point I have to sheepishly admit that I do tend to binge watch medical TV dramas, which is all the more sort of sad and pathetic because I spend so much of my time at work dealing with situations like those depicted in those popular shows. But really, I want to say for the record this afternoon, as I always do, that I wrote these poems really with a very different sort of intention in mind. I really wanted to challenge this idea that that the doctor is always sort of center stage in the experience of illness, and the way these shows, I think, sometimes sort of show patients as kind of the substrate on which the important characters work out all of their issues and their difficulties, and instead I really wanted to elevate and make more audible the voices of my very diverse and marginalized and often silenced patients, whose dignity and whose power really always continues to inspire me. And I also wanted to represent myself as the speaker of these poems, as imperfect and as vulnerable, not the knight on the white horse who comes in and saves the day all the time, but who's just as sort of complicated and again in some ways suffering as many of my patients. And so I wanted to read these poems with that as a kind of introduction. And the poems are called 10 Patients and Another, and you'll probably notice that they're sort of broken sonnets, and as sonnets, I think of them really as love poems to my patients, and really to all of us, because someday we'll all be patients ourselves. So this is a series of poems called 10 Patients and Another. I won't read all of them, but 10 Patients and Another. Mrs. G. The patient is a 60-odd-year-old white female who presents with fever, cough, and shaking chills. No further history could be elicited. She doesn't speak. The patient's social history was non-contributory. Someone left her here. The intern on the case heard crackles in both lungs. An EKG was done, which showed a heart was beating in the normal sinus rhythm, except for an occasional dropped beat. An intravenous line was placed. The intern found a bruise behind her ear. She then became quite agitated and began to sob without producing tears. We think she's dry. She's resting quietly on Haldol, waiting for a bed upstairs. Jamal. The patient is a 3-year-old Black male, the full-term product of a pregnancy that was, according to his grandmother, unplanned and may be complicated by prenatal alcohol exposure. Did okay, developmentally delayed but normal weights and heights, until last week when he ingested what's turned out to be cocaine, according to the lab results. His grandmother had said she'd seen him with some baby powder on his face and hands before he started seizing, and they brought him in. The vital signs have stabilized. The nurse is getting DSS involved. The mom, she left it on the kitchen table. That's her, the one who sings to him all night. Kelly. The patient is a 12-year-old white female. She's gravida 0, no STDs. She'd never even had a pelvic. 1 month nausea and vomiting. No change in bowel habits. No fever, chills, malaise. Her school performance has been worsening. She states that things at home are fine. On physical exam, she cried but was cooperative. Her abdomen was soft, with normal bowel sounds and question of a suprapubic mass, which was non-tender. Her pelvic was remarkable for scars at 6 o'clock, no hymen visible, some uterine enlargement. Pregnancy tests positive ×2. She says it was her dad. He's sitting in the waiting room. SW. Extending from her left ear down her jaw, the lac was 7 centimeters long. She told me that she slipped and struck her face against the kitchen floor. The floor was wet because she had been mopping it. I guess she'd had to wait for many hours since the clock read nearly midnight. Who mops floors so late? Her little girl kept screaming in her husband's thick, impatient arms. He knocked 3 times, each time to ask when we'd be done. I infiltrated first with lidocaine. She barely winced and didn't start to cry until the 16th stitch went in and we were almost through. I thought my handiwork was admirable. I yawned, then offered her instructions on the care of wounds. She left. Manuel. In Trauma 1, a gay Latino kid, I think he's 17, is getting tubed for respiratory failure. Sleeping pills and Tylenol, I translated for him as he was wheeled in. His novio explained that when he told his folks about it all, they threw him out like trash. They lived together underneath the overpass of Highway 101 for 7 weeks, the stars obstructed from their view. For cash, they sucked off older men in Cadillacs. A viejita from the neighborhood brought tacos to them secretly. Last night, with 18-wheelers roaring overhead, he whispered that he'd lost his will to live. He pawned his crucifix to get the pills. FP. Another AIDS admission. This one's great. They bring him in strapped down because he threw his own infected shit at them. You better bring your goggles and a mask. We think he's got TB. He's pissed as hell. Apparently he wants to die at home, but somebody keeps calling 911. A relative back home in Iowa or some damn place. Just keep him snowed with Ativan. Believe you me, you do not want to get to know this fucker. Capacities all over, stinks like shit, incontinent of course. How long before you get down here? Because his nurse is driving me insane. Of course we got blood cultures. Yeah, a gas. Okay, I'll stick him one more time. The things you do for love. Maria. This G1, P2 gives us a confusing history. It sounds like she's been pregnant approximately 30 weeks, although she can't recall her LMP. No pain, but bleeding for about 2 days. Of course, she hasn't had prenatal care, and God only knows where the father is. She works 2 jobs that keep her on her feet all day. She's been in the United States 6 months and doesn't speak a word of English. Bet you she's illegal. Cervical exam is unremarkable. The os is closed. I think we need an ultrasound to tell us more. Besides a look at her placenta, we need some confirmation of her dates. Her uterus can tell us more than she can. Jane Doe number 2. They found her unresponsive in the street. Beneath a lamplight, I imagined, made her seem angelic, regal even, clean. She must have been around 16. She died who knows how many hours earlier that day, the heroine inside her, like a vengeful dream about to be fulfilled. Her hands were crossed about her chest, as though raised up in self-defense. I tried to pry them open to confirm the absence of a heartbeat, but in death she was so strong, as resolute as she was beautiful. I traced the track marks on her arms instead, then pressed my thumb against her bloodless lips. So urgent was my need to know. I felt the quiet left by a departing soul. So not all that long ago, I was invited to give a reading as part of a series of events at a small Midwestern liberal arts college to mark World AIDS Day. And after my reading, one of the wonderful students who had organized the events greeted me and said, "Oh, it's just so great that you're still writing about HIV and AIDS, especially now that that we have a cure." And I was kind of dumbfounded, and I've been taking care of people with HIV and AIDS for probably 30 years now, and I wasn't aware that we'd found a cure for the virus. And then it struck me that what she was articulating was another sort of issue that I think is important for us to think about in relation to the humanities versus science and medicine, and that is that we tend to so overhype all of the advances, scientific advances in medicine, and I think she was really kind of expressing that kind of the way in which we're really so enamored of science and technology that we credit it with more than it actually can, I think, can do at times. And so I felt like I needed to write a poem in response to that, and this is the poem. And again, I hope that it provides a kind of a corrective to the notion that science and technology can save us. Of course, I'm so grateful for all of the scientific advances that have led to medicines that now can so effectively treat HIV and AIDS, and have in some ways changed it to a kind of a more chronic health condition. But at the same time, I remember that there are 40 million people on this planet infected with HIV, and most of those folks probably don't have adequate healthcare or access to some of these miraculous treatments. And so poetry, I think, is still so critically important for us to sort of bear witness to that truth. So this is a poem called Viruses. It was late, and I was wheeling the gurney to the ICU. Another sorry faggot dying. They say that viruses aren't living things, I remember thinking. I remember thinking that the crust around his mouth looked thick as toothpaste. I felt helpless as the night kept not ending, as the ER paged me saying I had another one down there still waiting for me. It was late when we heard the news about the virus spreading in a part of China I'd never heard of, a city of 10 million that I didn't know existed. We brushed our teeth together, side by side. You were already asleep, handsome and warm in the darkness, still breathing, still alive. They say the virus is a pathogen that no one's ever seen before. I gaze out from our window at the gaping hole that it takes me a second to remember is just the moon. It feels like the absence of countless souls. It's late. I'm thinking now about my patient in the ICU, racked with fever, how hard it is to die like that, alone, how hard it is to remember. I want to be sure we have some time to have questions, and so I'll read just a couple more things. I'll read this one very short poem, if I can find it. I often lead writing workshops for medical students and sometimes for people with illness in the hospital. That's been put on hold recently because of the current pandemic or the latest ongoing pandemic. And but I wanted to read this poem because I think it's another example, perhaps, of how again poetry can be actually in some ways, very practically useful and meaningful in the hospital. So this is a poem called Hospital Writing Workshop, and it was sort of my own response to a writing exercise I gave to my my workshop that was to write about something immediately, sort of in front of us. And what my workshop participants produced was far better than my poem, but I hope I can convey a little bit of what they wrote in response to that exercise. As a teacher who aspires to be good at teaching, I always do my own assignments. So so this was mine. Hospital Writing Workshop. Arriving late, my clinic having run past 6 again, I realize I don't have cancer, don't have HIV. Like them, these students who are patients, who I lead in writing exercises, reading poems. For them, this isn't academic, it's reality. I ask that they describe an object right in front of them to make it come alive. And one writes about death, her death, as if by just imagining the softness of its skin, its panting rush into her lap, then she might tame it. One observes instead the love he lost. He's there, beside him in his gown and wheelchair, together finally again. I take a good long breath. We're quiet as newborns. The little conference room grows warm, and there, before my eyes, I see that what I thought unspeakable was more than this, was hope. I hope I've given you some sense of the connection between poetry and healing, and how, in particular, poetry is I think so necessary for us in caring for people from diverse experiences, diverse points of origin, different ways of thinking about illness. And I thought maybe I'd read a couple of paragraphs, very brief paragraphs from another much older essay of mine, and then one last poem, and then we'll have some time for questions. So this is from an essay called AIDS in the Poetry of Healing. In poetry are present the fundamental beating contents of the body at peace, the regularity of resting brainwave activity in contrast to the disorganized spiking of a seizure, the gentle ebb and flow of breathing or sobbing in contrast to the harsh spasmodic cough, the single-voiced ringing chant of a slogan at an ACT UP rally in contrast to the indecipherable rumblings of AIDS funding debate on the Senate floor. The poem is a physical process, is bodily exercise. Rhymes become the mental resting places in the ascending rhythmic stairway of memory. The poem, perhaps, is an idealization or a dream of the physical, the imagined healthy form. Yet it does not renounce illness. Rather, it reinterprets it as the beginning point for healing. I wonder then whether poetry might also be therapeutic. Many of my friends, especially some of my colleagues in medicine, have teased me for believing in the curative power of words, joking that I should write some doggerel on my prescriptions instead of the names of medications and directions for their use. If poetry is made of breath or the beating heart, then surely it's not unreasonable to think it might reach those places in the bodies of its audience, however rarefied. Moreover, I joke back, I have never seen a poem cause fulminant liver failure or bone marrow toxicity, even a really bad one. Putting the mouth to words and by incantation returning regular rhythms to the working lungs, these were the principles by which ancient healers in Native American cultures practiced their art. The Egyptians gave their dead a book full of charms and spells to be used in the afterlife. Might not poetry then facilitate the passing to another realm? Poetry is a pulsing, organized imagining of what once was, or is to be, what life once was, what life is to be. It is ampules of the purest, clearest drug of all, the essence and distillation of the process of living itself. So, you know what, maybe I'll read a much shorter last poem. So I'm sure we have time to have some questions. Before I conclude, I want to thank you all again for coming this afternoon. And I really do look forward to hearing your questions. And I apologize, I went a little bit longer than I had anticipated. So this last poem, if I can find it, is maybe I should just stick with what I was going to read. Oh goodness, you can never find it when you're. All right, here it is. My voice. Thank you again for your attention, and I look forward to your questions. And thank you also to Diana and Tamara for making my visit possible. My voice. To cure myself of wanting Cuban songs, I wrote a Cuban song about the need for people to suppress their fantasies, especially unhealthy ones. The song began by making reference to the sea, because the sea is like a need so great and deep, it never can be swallowed. Then the song explores some common myths about the Cuban people and their folklore. The story of a little Carib boy mistakenly abandoned to the sea. The legend of a bird who wanted song so desperately he gave up flight. A queen whose strength was greater than a rival king's. The song goes on about morality, and then there is this line about the sea, how deep it is, how many creatures need its nourishment, how beautiful it is to need. The song is ending now because I cannot bear to hear it any longer. I call this song of needful love my voice. Thank you so much. And please, questions, comments.
What a wonderful note to end on, Dr. Campo. Thank you so much for sharing your personal narrative and your incredible voice through poetry and your writings. It really has been inspirational to hear your writing. So thank you very much, and for sharing so much of you and sharing your patience with us as well and your experience through them.
Thank you. Thank you. Thank you.
There are lots of questions that were submitted even before the event. So I will go through some of those, but I also encourage people to please message me in the chat, or you can write your question in the chat and we'll try to get to those as well. And last but not least, before you all leave, please remember to fill out our evaluation for today's session. So thank you so much again, Dr. Campo. It was really wonderful meeting you and hearing you. So one thing that came up, sure. One thing that came up was people asking about how we can balance celebrating a general Latino culture while acknowledging its multiple separate subcultures.
Yes, I think that's a great question. And I think one way is to perhaps simply acknowledge the richness of Latinx culture. And I tried to do a little bit of that in sharing my poem, The Chart, which I think as a way of kind of representing, just the tremendous diversity within Latinx culture itself. And of course, there's so much more richness and diversity that could be expressed through poetry and through narratives. And so I do think that really just gathering together and hearing all of those rich and diverse voices and perspectives is really the best way to do that. And by doing that, by telling our individual stories, I think, and sharing our personal narratives, we can kind of push back against this notion of a kind of a generic Latino identity. I mean, there is so much that we share, and that's a wonderful thing about Latin cultures. And I have some cousins from Argentina visiting this week, and all fully vaccinated. I was reflecting on that a little bit, that even though there's so much difference between us in many respects, we also have so much in common. We share so much in terms of our sort of Latino-ness. And so I think that's also a wonderful lesson for us as we negotiate disparate and diverse identities, and just more generally, that I think ultimately we have so much more in common than we have as sort of differences, that I don't know, I think of Latino culture as a wonderful way of modeling how we can be both joined in shared experience, and at the same time honor distinct experiences and differences as well. And so I don't know, I think we're getting more and more sort of bogged down lately in the kind of discourse around identity that or critiques of a discourse of identity that says we're too focused on our own particular stories. I think actually by telling our stories together and sharing them, we can see the commonalities as well as the differences. I mean, that's the way I sort of hear it and think about it. And perhaps that does have its roots in sort of my Latino identity, and also being sort of a dual. I mean, we're all so many hyphenated identities that it seems to me natural that we would be able to embrace both the universal aspects of our experiences and the distinct aspects of them as well. So
great, thank you. And we loved that poem, The Chart, loved it.
Oh, thank you.
So actually, Diana has a question that she would like to ask, so I will pass it over to her to ask live.
Thanks so much, Tamara. Thank you so much, Dr. Campo. This is kind of a combination of some of our audience members' questions and my own. Somebody brought up the poetry pharmacy in England, and I think that connects a bit to the work you were discussing that you were doing with patients and writing poetry or having writing prompts. And I'm wondering if you could speak a bit to how at Harvard you or the humanities program has translated some of the benefits of poetry into the realm of patient care.
Oh, that's a wonderful question too. Thank you so much for asking. There are a number of ways we're doing it. I think one way is actually through medical education and exposing our students, our learners to poetry and other kinds of narratives about the illness experience, which then they bring to their work with patients. And I think really, again, in the ways I was hoping to try to illustrate a little bit in my reading, how that kind of larger context can really make them more attentive listeners and help them to be more empathetic and more present for our patients. And there is actually a little bit of data out there for those who are fans of the science of this, which I think is also important to highlight, that shows that the use of poetry in medical education settings can actually diminish the erosion of empathy of medical trainees. So that's one sort of perhaps indirect way. I have for a long time held sort of informal writing workshops on the wards. I haven't been able to do that recently, as I sort of briefly said, because of some of the restrictions related to gatherings during the pandemic. But that is another way that we are trying to integrate the humanities into the actual ward setting directly with patients. And there's a couple of other similar initiatives here in Massachusetts. The Massachusetts Humanities Council sponsors a program as well that brings docs, people living with illness, staff members, allied health professionals into workshops where we read texts, literary texts together and discuss them. And those discussions are led by one humanities professor typically, and one representative from the sort of the medical world. And so, and those take place in the hospital and are open to our patients, to our students, as I said. So those are just a couple of examples. There are many others, but I want to make sure we have time for other questions. I know we're getting close to the end, or maybe we're already over, but and I'm willing to stay a little longer if people have questions and can stay, but I also want to be respectful of people having to run off to other duties. So.
Well, we certainly want to be respectful of your time, but if you wouldn't mind another question, it would be wonderful.
I'd be happy
and I also just want to draw your attention to the chat. There have been quite a few just glowing comments thanking you for your words and for sharing your time with us. So I want to make sure you check those out as well. I will ask about how do budding poets seek mentorship and develop their craft? It's one of the questions that came up.
Yes, well, I'm, of course, always happy to hear from aspiring or budding poets and writers. So, and I'm pretty easy to find. So please reach out to me. There are many, many programs. I know at Stanford in particular, you guys are tremendously rich in programming in this area. There's Medicine in the Muse. There's the Pegasus Physicians Writers Group. So these are all settings, I think, where aspiring writers can come to find like-minded folks and share in community and develop their craft. And so those are some ideas that come immediately to mind. I mean, there's, of course, the sort of more formal kinds of writing programs out there. I actually took a year off between my third and fourth year of medical training because I thought I had made sort of a terrible mistake going into medicine, and I'd spent a whole year getting an MFA or actually it was an MA in creative writing and poetry at Boston University. So that there's those kinds of resources out there as well. And but I think just finding a community, create your own writing group if you want to get people together to do this work together. It's really sustaining and it's worth, I think, the kind of time and effort that you might put into that, because it just pays back in so many ways and is so renewing and so empowering as we do this very difficult work of healing.
Yes, I was just thinking powerful and impactful on so many levels. So with that, again, we want to respect your time. Thank you so much. Everyone, please remember to fill out an evaluation. Dr. Campo, many, many thanks for sharing your time and your words. We really appreciate it.
Thank you so much. Thank you all for listening and for participating, for your questions, and thanks again.
All right. Bye-bye, everyone. Thank you for coming.
Thanks again.
Thank you. One more thing that people did ask, by the way, is if we could get a list of poems. I think one of our colleagues was going to go through and list them again. If there is a list or somewhere they can access them easily, it would be.
Oh, of course, I'd be happy to share that. Yes, give a poet an inch and he'll take 5 and give you plenty of a long bibliography of his work, so you can you can read it. So yes, absolutely, I will be delighted to share that with you, and just thank you all again so much for making this such a wonderful experience. And I hope it came across okay on Zoom. I always feel a little, you know.
Let me stop recording.
It was